Welcome to Season 17 of Marrow Masters, sponsored by Insight and the Leukemia and Lymphoma Society. This season focuses on adolescents and young adults, or AYAs. They are often caught in the middle, too old for some pediatric practices, but much younger than other cancer survivors in an adult clinic. We'll be talking with a variety of speakers this season who will share their best tips, tricks, and ideas for this unique segment of the population. Our guests will offer grit, honest feedback, advice, hope, and so much more. Here's your host, Executive Director of the NBMT Link, Peggy Burkhart.
Hello, everyone. So today we have with us Emily Long Sarro, a board-certified family nurse practitioner and the adolescent and young adult nurse practitioner at Memorial Sloan Kettering Cancer Center. Emily spends a lot of her time at the center with young adults with cancer, and she's going to share her wisdom and best tips with us today concerning life before, during, and after a life-saving transplant. Welcome, Emily.
Thank you for having me, Peggy.
So let's jump right in. Emily, what is the approach you take when you're dealing with adolescents and young adults that you see?
My approach really is to look at them as a whole person. I really aim to marry the science of the diagnostics and their treatment along with their emotional and mental health, really hoping to provide holistic symptom management, making sure that we can help fill in that care in the in-between where they may not be getting it otherwise.
So important and so true. So Emily, let's define first the age range that is assigned to young adults, because it varies from what I can tell.
So the National Cancer Institute defined it as 15 to 39. And, this is just such a time of change. People are exploring their identities, whether that's their gender identity, their sexuality, their life goals, who they want to be around. They're looking at their family planning, their relationships, and then also looking at their mental health. So the brain changes dramatically during this time period too. And people are looking at where do they want to go in their careers. So this is really a time of change. And when somebody is diagnosed with cancer during this time period, it can amplify some of these changes, or it could also halt them. AYAs don't really necessarily fit in any specific healthcare area. So they don't really fit in at a children's hospital. If you go to a general oncology clinic, they're not really feeling like they can relate to others there when they look around in the waiting room and everyone around them is in their 50s, 60s, or 70s. So this population, the AYA population, is quite vulnerable as they're going through the medical system and all of these changes at the same time. They don't quite fit in.
I can see that. We see it with our constituents and who reaches out to us. And I love the way you're describing it. It really makes it clear how unique they are, and their challenges are unique. So Emily, speaking of challenges, what are the challenges that they face when it relates to their families during treatment?
Every one person is different. We can look at themes, but it's not that there's one story for all young adults. So you might have a 25-year-old who's out on their own, they're just starting their new career, and now they have a cancer diagnosis. Well, do they need to move back in with their parents? Mm-hmm. Sometimes young adults become infantilized, so they practically regress, or their loved ones, their family members, treat them like a child again. Mm-hmm. So we really want to look at how are we supporting AYAs? How are we giving them their own voice so that they have a say in this? And, relationships can be strained. So no matter what age somebody is when they're diagnosed with cancer, it can really complicate things. So we want to make sure that we're asking AYAs, who do they want involved in their decision-making? And then also providers, I urge you, please ask the people that are there with your young adult patient to step out of the room. I find it to be kind of seamless around the physical exam. Say, I'd like to examine your loved one here. So I'm going to ask you to step out of the room for a couple minutes. And then you can have that time to talk with them about maybe some more sensitive topics. Or, sometimes young adults, they don't want to disclose something in front of their mother or their father or their grandmother. So it gives that time where they can be a little bit more candid with you and make sure that their wishes and their concerns are being heard.
I'm guessing it's probably a relief to most parents, too, that somebody else is sharing the burden of all of this and helping their child maybe in a way that they can't help them.
Right. Often people don't know what to ask or how they can even help.
Yeah, no, I think that's so wise to do that. And as a parent myself, I would imagine that I would feel almost relieved that the person in charge is asking me, because when you're a caregiver, you're making a lot of the decisions. It's kind of nice when somebody just tells you the right thing to do.
Right.
Right? So mental health, we know that this is such an important component to transplant, regardless if you're 30 or 60.
Mm-hmm.
Is it different with AYAs? And if so, how is it different?
Yeah. Being diagnosed with cancer or needing to go through a transplant, there's so much emotion that can come up with that. With young adults in particular, we do see higher levels of anxiety and depression in this population. We also see some components of post-traumatic stress. We really want to help link young adults to different mental health supports. So I urge you to please, look out for a mental health counselor or a social worker, a psychologist, a psychiatrist. I imagine that your transplant team has those resources available to you or can at least direct you in the right direction. If not, please ask about them. There are lots of great resources. I mean, there's Cancer Care, there's Immerman's Angels, there's somewhere they can help with peer support.
Mm-hmm.
So talking with others that have gone through something similar so you feel seen and that you can relate to somebody. But then also sometimes people say, I don't want to hear about somebody else's story. It's too much for me. But I'd be open to speaking with somebody one-on-one, a professional counselor. I believe it's part of the care plan. Everyone should have some mental health support while they're going through their transplant and even in the time after. Because maybe you're not able to process all of it in the moment, but
Sure.
6 months, a year, 5 years later, some things can still come up. So it's great to have additional resources and connection in that way.
Absolutely. So let's talk about coping mechanisms, meditation.
Mm-hmm.
How do you feel about that as a supplement to the care that they get from a mental health professional?
Yeah, if you're meeting with a mental health professional, it's 1 hour a week at most, right?
True.
So often it's once a month or once every 2 months. And so you need things to help fill in with your coping and support in the in-between. So meditation, prayer, journaling can be really helpful. Really looking at movement, right? Like we know that when we're moving our bodies, we can release endorphins at the same time. And so that's going to play into our mental and physical health. And it doesn't need to be, I do not want you out running marathons too early or
Exactly.
lifting, 250 pounds in a deadlift. Really just walking.
Yes.
Or if you're admitted to the hospital, moving around your hospital room, getting up and into a chair, doing some physical therapy exercise. That can all go a really long way for people.
Yeah. And then you sleep better, which
Yes.
we know how important that is.
So crucial to healing.
It sure is. Emily, let's talk about trust. So young adults, I've been reading a lot about this. I actually got to attend a webinar. How can the medical system better serve young adults and their families in this regard?
So often I hear the stories of, a young adult that they went to their doctor time and time again. They went to an urgent care center and they were saying, oh, you're 30, like it's just a cold, or, oh, it's a slight pneumonia. We'll give you some antibiotic and you'll be fine. And so really what might be underlying there, and there's not a full workup because providers may not be thinking of a malignancy in a young adult, it can end up being cancer. And so often it seems like young adults feel they're not heard. They've lost trust within the medical system. And so it's our job as providers to really make sure we're listening to our patients, that we have a broad differential diagnosis. And remembering that, 89,000 adolescents and young adults get diagnosed with cancer every year in the United States alone.
Wow.
So we want to make sure that we're doing that full workup. And then for those of us that work in larger academic centers where they already have a cancer diagnosis, or once those patients have that diagnosis and are starting on their treatment plan, it's our job to continue building on that trust and making sure they're getting the resources and their voices are being heard.
No, this is so important. Thank you for sharing that. So fertility, we know it's the elephant in the room. I'm sure a lot of times when you're trying to save someone's life and it needs to be discussed, and as well as relationships and sexual health. Can you share what you know about this?
Yes. So fertility preservation, In an ideal world, it needs to be done before a patient has any cancer-directed systemic treatment. We know that sometimes that's not possible. If it's a leukemia diagnosis and the person needs to start treatment as soon as possible, females, egg preservation, that process takes 2 to 3 weeks. And so sometimes they're not able to delay cancer treatment to start that. For males, it can sometimes be a little bit faster, a little easier access because it's a more straightforward process. But the most important thing is educating patients on the potential risk to fertility. With a stem cell transplant, most often patients are rendered infertile at the end of it. And so we want to make sure that they have potential options ahead of time and that they are at least informed, because it can be heartbreaking for people when they learn after their transplant that they're not able to build a family biologically. And what we want to make sure is that even if somebody was educated prior to their transplant about the risk of becoming infertile, that we do revisit that periodically to make sure that it's not new information that they're getting at the end. And there are other options. So if someone is unable to have their own biological family, there are resources around sperm or egg donors, around embryo donation. Also, if somebody has embryo or eggs, they are able to look into finding out about a gestational carrier or surrogacy. And then, of course, adoption is another way. So families can really be across a spectrum and look in all different ways. And we want to make sure that AYAs are feeling empowered in that and are aware of the potential options out there.
I think that is so fantastic that you take the time to cover that. It is so important. What about the cost of all of it, Emily?
Unfortunately, costs can be prohibitive for this. What I would recommend is find out from your health insurance company if you have benefits to cover fertility preservation or any other interventions. If it turns out that you do not have this health benefit, then you can look into different organizations and grants. So Livestrong often is able to provide discount pricing for people if they meet that financial requirement. There are others like Worth the Wait or Maggie's Dream. So there are some organizations out there that can help make it a little bit easier to access for patients. And also talk with the fertility clinic, see if they have a payment plan or if they have potential discount pricing for those that are being treated for cancer or going through a stem cell transplant.
Thank you, Emily. So we also have another episode, Season 9, Episode 2, where we do a deeper dive into all this. It was the season, What I Wish I Knew Before Transplant. And in the show notes, we have all the links, and we'll also include them in your show so that people can access these easily and click on them and see, what their options are. And what a great job for even the caregiver too, to do that investigating or a friend, people want to help, give them a job to get that information handy because it is so important.
Yeah. Another thing that I just want to point out too is not everybody wants to build a family. So I think that sexual health is also very important, especially for the young adult population.
Yes.
Even if somebody does not want to have a baby biologically, intimacy is a natural part of life. And so for those that have undergone cancer treatment or a stem cell transplant, they can be left with sexual side effects. Or, they might have a strained relationship. So really trying to communicate with potential partners about what some of your needs are or what some of the interventions are in terms of lubricants or moisturizers. There are some great supports out there to help maintain and preserve that life too.
I'm so glad that you mentioned that because that really is so true. Just trying to get your full life, your quality of life post-transplant. So Emily, we also know young adults undergoing cancer treatments, they're definitely going to be missing out on major milestones, events. How do you help your patients with this?
Really looking at trying to frame it of you might be missing out on this event right now and hold space for that because I know it can be very frustrating and I know you can feel sad and left out about this. And our goal is to help you to get to more events in the future. If there are ways of, if there's a big party, maybe joining over a virtual platform so that you could be a part of it. Or if there's a graduation that you're missing, maybe you could do something smaller with a few friends that you trust while your immune system is repairing. And really, people often find themselves comparing to others on social media. So really being intentional about your use of social media. Some people find it extremely helpful. They have peer communities, they find validation and relatability, and there can be some really wonderful things that come out of social media. And at the same time, it can be challenging for people because they're seeing the parties, they're seeing the vacations, they're seeing the new births and the marriages, and they might feel left out.
Yes.
So I think that talking with others about this can be helpful, and really trying to compartmentalize or limit what you're seeing if that's helpful too.
Yeah. You're making me think of the app. It's called Cancer Buddy. The Bone and Marrow Foundation has done an incredible job setting this up. And it's just a great networking social media tool for young adults with cancer. And I just hope that anyone listening to this, check it out. There's different groups. They have discussions. They have, social gatherings online all the time. And they are working so hard to make this what it needs to be for youngsters and even middle-aged people. I hear that, there's just so much comfort in meeting other people that can relate. So I just wanted to mention that as well. So Emily, the other big topic for young adults is their careers and their jobs, their insurance. So how do you navigate that?
Yes. There are people that are able to continue to work depending on what their work is. If you're a bedside nurse, you obviously cannot be going through a stem cell transplant at the same time of being at the bedside with somebody else, right? But for some people, they might have work from home accommodations. They might be able to take part-time. So talk with your human resources departments, with your managers, see what's possible. What leave benefits do you have? Are you able to take a leave of absence? Does that mean you're going to lose your health benefits? Looking at applying for unemployment. So working with your social worker from your medical system side, or if you have a vocational counselor, and then also with your employer, looking at your human resources and your manager to see what's possible. Cancer in Careers is also a wonderful organization. They've done a lot of advocacy work because there's often questions around, what do I have to tell my employer? What should I not tell my employer just to protect my rights? And so they have webinars. They're able to help really educate people on the best way to navigate that.
Yeah, we love the work they do. And actually, we have several lunch and learns where they have helped us out. You told me something about a silent disability. Could you tell me more about that?
So I have patients that I will see even years after transplant that are still navigating some of these long-term side effects like chronic graft versus host disease or some mobility concerns. And they are still out there, back out into the workforce in the career and on their career paths, but they have these silent disabilities where they are struggling through some of these symptoms, but they might not look like it. And so they have to know how to advocate for themselves, to get the right chair at their desk, to make sure they have appropriate breaks throughout their workday so that they can make sure they're still functioning at a high level for their performance.
That's great. Thank you. So Emily, let's talk about survivorship care and just how important it is to stay healthy and strong.
Yes. So for a patient that is a young adult and receiving a stem cell transplant, they're getting high doses of chemotherapy. And although that can be life-saving, it can have increased toxicities down the line. And so it's so important to be connected with a survivorship team or even your primary care provider who's aware of your oncology history so that they can connect you with the best guidelines to monitor for any late effects and making sure that your heart is functioning the way we need it to, and that your hormones, if we can adjust anything with your hormones so that you are feeling as well as possible. Also, if you're finding that some of these side effects, you're just not getting the results that you need, look into complementary methods as well, whether that's massage or acupuncture. Because kind of marrying these two worlds of Western and Eastern medicine can go a long way to help patients feel well and to live a picture of wellness.
Okay, thank you. So caregivers, we love our caregivers. And we know that can be a little tricky. We touched on it earlier. Any tips for young people who are caregivers and how they can better help their friend or their sister or their cousin or whatever it is?
Caregivers are so important, and we rely on our caregivers, right? So I would say checking in with your loved one who is the patient, allowing time for them to express what their concerns are, or just be. Just allow them to cry or be angry or process all of this. I think also making sure that you're seeing them as a person and not only a patient. You're seeing them beyond just being sick. You can talk with them about quote unquote normal activities, music, current events, what's the latest gossip at work, whatever the case is, so that they feel like there is life beyond that hospital room that they're in. People want to feel a sense of connection. Also, it might just be that they don't want to open up right now. They are processing a lot and it's not the right time, and they have to really put their head down and go one foot in front of the other to get through this process, and that's okay too. So they might not know what they need. You can offer peer groups. You can offer helping them find a therapist or the best wig resource, looking up gentle soaps or lotions, things that might seem unbearable for them, another thing on the to-do list. That's a way to offer your support with them.
Great. This is my favorite part of the program. So, Emily, do you want to share a unique story of a survivor, someone that really touched your soul?
Sure, yes. I mean, there are dozens and dozens, but I was just thinking about this patient the other day, really. So he was a 21-year-old man. He's from the Bronx, and he was very cool, very independent, didn't need anybody. He was raised by a very strong single mother, and he knew he is going to be a music producer. So he was diagnosed with MDS and needed a transplant imminently. He came to our institution, but he knew best. He didn't need us. He didn't trust the medical system. He wouldn't look at the doctor in the eyes. He was looking at his phone. He said he didn't need a sperm bank. Like, he would be all right after this.
Okay.
He would be able to father a child just fine. So we had to go with a different approach. We had to kind of meet him where he was, explain the risks. His mother was a wonderful liaison between the medical team and the patient. And ultimately, he agreed. He consented to the transplant, but he still said he wasn't going to sperm bank. He was going to be all right. So he was admitted and getting ready for the transplant. And at the last moment, I mean, I think chemotherapy was starting in the morning. And he said, okay, I'll sperm bank. And the nurses, the medical staff were wonderful, really just doing everything everybody could to make sure that this would happen for him. And he was able to successfully sperm bank. His start of chemotherapy, I believe, was pushed off by just one day. And he went through transplant and he got very sick. He had his eyes set on that discharge. He knew he had dreams. He knew this wasn't the only part of his story. He had so much more to do. And he really developed strong relationships with his nurses, with me as the nurse practitioner, with his primary oncologist. He started smiling and thanking people for their help, really being grateful. And then even when he had to be readmitted after his discharge for viral treatment, he understood the risks. He knew what he needed to do. He was admitted and was up every day doing exercises, keeping himself moving. he would see that his friends were out partying and hustling, and he'd say, I'll get back there. I'll get back there. But he was really steadfast in his recovery and his growth. So, that was a few years ago. And I see videos now of him.
Really?
And he has a thriving music production business. And when I see him, in these videos and he's with his friends, and I just wonder, do they realize all that he has overcome and how sick he was and his mindset, his positive mindset that really helped to get him here? And then I wonder, does he even realize? Is he able to reflect on that and all that he has overcome?
Sure.
But every patient leaves a little piece with you.
Yeah. Oh, my goodness.
And I find strength in caring for all of them. I find the patients to be most inspiring. And that's how we keep doing what we're doing.
Wow, Emily. I have tears in my eyes. This is just such a beautiful story and so full of hope.
Mm-hmm.
And I'm so happy for this person. Now I want to meet him.
Yes.
Emily, you have just shared so many important things today, and we really appreciate what you do. It's obvious you love what you do. And thank you. Thank you so much for helping us today. And
yes, thank you. It's a pleasure to be here. And I want to thank the National Bone Marrow Transplant Link for having me. This has been a wonderful experience, and I'm so happy just to help raise awareness about the unique needs of adolescents and young adults.
Thank you.
This has been the Marrow Masters podcast. If you know someone who would benefit from the information in our show, please share this episode with them. And don't miss future episodes of our show. Follow Marrow Masters for free on Apple Podcasts, Spotify, YouTube, or wherever you're listening right now. And to connect with the National Bone Marrow Transplant Link, visit nbmtlink.org or tap the link in our show notes.